I'm Lily.
And I'm Corinna.
Welcome to Zen Flamingo. The use of essential oils can be so beneficial and enjoyable, but we must be knowledgeable about the safety guidelines on how to use them. So Corinna, what are some of the factors that contribute to the risks of having an adverse reaction to essential oils?
The dilution that you're using, the duration that you're using it for, the frequency of use, once a day, twice a day, whatever, that's the frequency. The mode of application as well. Are you using it topically? Are you inhaling it? And so on. And then you have to also know some of the host factors, other factors that are individual to you, such as the age of the person using the oil and other health issues that can affect the person, such as is a person suffering with asthma, COPD, or emphysema. Two oils that are very important that you know more about that can be dangerous if inhaled extensively if you are having conditions that you suffer from are eucalyptus and peppermint. So always use with caution.
Many oils may look alike, some may smell similar, but they all have their own chemical makeup. So when it comes to using essential oils, what is the therapeutic window for a particular condition that we want to tackle?
And that's a really good question. So we're talking about not just inhaling for pleasure, with a diffuser in the room just because you like the scent of the oil, but using it for particular conditions such as relaxation or, headaches and that sort of thing. So therapeutic window is just a fancy way of saying the window, the least amount that you need for an effect to the most amount that you should be taking for an effect before things become adverse. Now, if you go to the doctor, or if you talk to your pharmacist and the doctor writes a prescription, on that prescription they will say how much you need to take, how often you have to take, so the dosage itself. So that's been calculated for you being female, maybe your body size, your age, and so on. So this particular drug you need to take this amount for this long, this often, and so on. When you are using essential oils, you're not given that information, so you have to figure it out. So it's important that you know each essential oil. Otherwise, if you take it too much, you can sensitize to it or have adverse reactions. So no one is doing the calculation for you unless you go to an aromatherapist. You have to figure that out yourself. So you have to be very cautious when using them.
Right. So we don't want to overdose on medications. So similarly, that rule would apply to when using essential oils.
Absolutely. Absolutely.
I want to share a personal experience. I was using a peppermint lip balm for 6 months, many years ago. One day I woke up with my lips swollen, and I didn't know at the time what it was, but then later on, after taking classes on aromatherapy, it's the peppermint in the lip balm that caused that sensitization on my lip. It was over a period of 6 months, then it started to appear, and I had a reaction to it.
That's really interesting. So if you're making your own, you'd have to be very careful to use a very low concentration for you, or none at all of that particular ingredient.
Yes, exactly. Yeah, I'm very sensitive to peppermint. Always remember to start low and slow. So low dilution of use, low frequency, and then slowly working up from there.
Right.
Not everyone working with or selling essential oils are qualified aromatherapists, just to keep that in mind. Corinna, when it comes to interactions with medications, what are some of the essential oils that we should be aware of?
So this is just a partial list. By no means is it completely exhaustive. So lemongrass, Mei Chang, honey myrtle, and lemon myrtle are all high in their citral content, which can be very irritating to your skin, so just be aware of that. Balsam poplar, blue chamomile, also known as German chamomile, blue tansy, yarrow, they're all very high in chamazoline, and that can also be irritating. Sweet birch, wintergreen are very high in methyl salicylate, and should be avoided completely for anyone who's taking blood thinning medication such as warfarin or is taking aspirin.
There are many different methods of using essential oils, such as inhalation, diffusion, topical, and combination of the above. There's also those who use ingestion of essential oils. Due to the lack of sufficient data and regulations on ingestion of essential oils, we do not recommend this method. Corinna, what are the do's and don'ts about inhaling essential oils?
So inhaling can be done in several ways, such as using electric diffusers, aroma jewelry. Those are very pretty that you can wear, and you can have the scent like hanging from a necklace or around a bracelet.
Yeah.
Terracotta discs is another way, using lava stones, and lava stones are also used in jewelry. Personal inhaler, facial steamers, and also a warm bath, which gives you the benefit of the inhalation as well. So inhalation is the most universal application method, and it is especially beneficial for certain respiratory issues, not respiratory conditions that have been diagnosed, but respiratory issues that are temporary, as well as a psychological well-being. When inhaling the scent from essential oils, the particles go into your bloodstream and enter the lungs. And they can also go into the brain when inhaled through the nose. It is interesting to note that essential oil compounds reach our bloodstream very quickly when inhaled, as opposed to being applied topically.
There are two reasons why this is happening. So first of all, the lungs have a much richer blood supply than the skin. And secondly, lungs have a total surface area more than 40 times greater than that of the skin. What are some of the inhalation risks that we should be aware of?
Well, definitely, first of all, to consider how long you've been exposed to the oil. Intermittent diffusing should be done as opposed to continuous diffusion. So that would be something like 30 to 40 minutes on, and then 30 to 40 minutes off, and then you can repeat. Also, how often you have used the inhalation, and the quality of the ventilation in the room. That is one of the most interesting things. You're using essential oils to making blends, or maybe formulating your own, anything that you're formulating with essential oils in a room, and then you start feeling sick. You need to make sure that when you're working with essential oils, you have proper ventilations in the room that you're working in.
Mm-hmm.
And then also to keep in mind how close the diffuser is to you and the air quality index of that day. Believe it or not, that affects every aspect of our life. Even if you're deciding to go for a jog, if the air quality is not good, you shouldn't be going out for a jog. Same thing with use of essential oils. Mm-hmm. Poor air quality indicates that the ozone levels are very high, and some of the compounds in the oils can react with the ozone and create potentially dangerous secondary compounds. Limonene, which is found in some of the citrus oils, plus the ozone can actually react together to form formaldehyde, which is not very healthy for us at all.
Right. If the liquid in a ceramic diffuser has all evaporated, then the oil may start to burn. And burning is a chemical change, so the substance that is created might not be great. We will be talking more about all types of essential oils and how to use them, and doing demos, and stay tuned for future topics.
Enjoy. Should I put the on button?
Yes.
Low and slow is the way to go.
It is. Action.